If I had $1 for every time that a patient came in telling me that their nasal spray didn't work and then showed me they weren't using it properly, well, I'd have a lot of dollars. I'm Mel, and I've been a primary care nurse practitioner for over 14 years. I'm passionate about teaching providers how to have effective clinical conversations. It's the stuff they don't teach you in school, but you absolutely need in your everyday practice. By the end of this video, you're gonna know the correct technique, why it matters, and have a framework for teaching your patient how to properly use nasal spray medication. A script that you can use in your everyday practice. So here's what happens. Your patient gets a nasal spray medication over the counter, or they've been prescribed one by you or someone else. They come back in saying this nasal spray isn't helping. The problem is no one taught them how to use it correctly. And let's be real, yes, it comes with a full detailed package of instructions, but who reads instructions anymore? The good news is there's YouTube. So when you ask them to show you how they've been using it, what do? Tilt their head back, squirt, and sniff at the same time or immediately following. And where does all that medication go? Down the back of their throat. When they use that technique, they're for sure coming back and telling you that medicine didn't help me at all. And maybe they're complaining about side effects. The nosebleed, the nasty taste, the dryness. The worst part is some of these patients, they've failed the nasal spray medication and they wind up going on an antibiotic or treatment failure for otitis media, a sinus infection. The truth is the medication really never had a chance. It wasn't being administered properly. So as promised, we're talking about nasal spray medication administration. Say that one 5 times fast. Be sure to stick around to the end because I'm going to tell you about some time-saving resources that are coming that you definitely don't want to miss out on. So let's dive in. Picture this. It's 3 o'clock in the afternoon in my primary care clinic, and I've got a patient, we'll call her Sarah. Sarah is here and she has complained of continuing nasal congestion, drainage, a little bit of headaches, sneezing for 3 weeks. She saw me or another provider 2 weeks ago and nasal corticosteroids were recommended. Sarah got Flonase, started using it every day, and has seen no relief yet. You know, she's frustrated. She wanted to be feeling better by now. In all fairness, she's given it 2 weeks. One of the first things that I do, and what you want to do, is say, how are you using it? And I'm telling you, I can predict it almost every single time. She will tilt her head back, aim that bottle in deep, squirt, immediately sniff as if we're getting it to the brain. Every single time. I know that's how they're going to do it. And then I know exactly what comes next. It's me saying, that's not the right way. That's why you're not any better. And then they kind of look at you, little deer in headlights, like, what? Maybe they're just embarrassed or disappointed, or maybe they're even frustrated. They have been faithful. They've spent their money on medication. They've lost time without having gained any improvement in their symptoms. Maybe she says, I've been doing it wrong this whole time. Nobody told me there's a specific way to use this medication. It's not her fault. Although again, it comes with instructions, but nobody reads instructions. Honestly, she's doing what most people intuitively do. It feels like that's the right way. How is she supposed to know if we didn't tell her? And this happens all the time. The real failure is nobody taught them how to use the nasal spray medication properly. Today, we are fixing that. And the awesome part is, maybe it takes you 90 seconds to have this conversation. When they come back in, they were better most of the time. And your patients are immensely grateful. Better patient outcomes, symptom improvement, that's why we do this work. So we're gonna get into how to properly administer these nasal spray medication, but first let's zoom out and talk about why it matters. 1, patient outcomes. We want our patients to feel better. They wanna feel better. And the technique is so important, whether it's a corticosteroid like Flonase or Nasacort, or an antihistamine like Astepro, or a decongestant like APRN. We want to make sure the medication gets to its intended target. In order for it to work, it needs to get there and stay there. When they tilt their head back and sniff, they're bypassing the nasal mucosa and sucking it all down the back of the throat. It can wind up giving them definitely a nasty taste, maybe throat irritation, maybe nausea because they've swallowed it. Even worse, they are still congested, they're still draining, they still have the same problem. The second would be safety. We don't want them having nosebleeds, heaven forbid if they're on an anticoagulant. We don't want their smell being affected. The third is antibiotic stewardship, when in reality they just had improper technique. A lot of patients wind up being given an antibiotic in the name of treatment failure, and an easy justifiable antibiotic. We don't dive into the details about why there was treatment failure. We definitely want to make sure we're not just saying, oh, 2 weeks, they've tried it, they're not any better, we need an antibiotic. Let's don't justify an antibiotic without first confirming it was genuinely treatment failure. This is why technique matters, and this is why teaching matters. The fourth would be trust. When you take the time to to teach a patient proper technique, have them return, demonstrate, or explain, you are building trust with your patient. You are showing them that you care, helping them to feel competent, not just handing a prescription and being dismissive. Now listen, no judgment. We are super, super busy, especially with primary care shortages, overflow demands on urgent care and retail health. Time is a rare commodity. We don't have as much as we need. That is why if you learn how to have a concise, clear, clinically effective conversation, this will be the difference between a transactional visit and a transformational one. All right, the correct technique, I'm gonna demonstrate, break this down step by step. Then I'll give you the exact script that I use to quickly teach a patient during a clinic visit. The first step is to gently blow their nose. When they blow their nose, they're gonna help maximize medication absorption. I stress gently. These patients are already dealing with congestion. When patients blow their nose really forcefully, they worsen congestion. Now, I've had this conversation. Don't repeat this. I don't know. 10 years with my husband, still blows his nose like he is blowing his brain out of one nostril. Any other medical professionals who can identify with their spouses, like just not listening to them? Hello, but don't tell them that I told you. All right, make sure that you tell them to first blow their nose gently. Take your nasal spray, shake it gently. If it's a brand new bottle, they need to prime it. They are going to pump it twice and they'll notice the first pump, pretty much nothing comes out. The second pump, about half of that spray medication starts to spray out. So you prime the line so that when they go to administer it, they're going to get a full dose of medication instead of a partial one when they've opened a new bottle. First step, gently blow. Second step, shake your bottle. Third step, if it's a new bottle, prime the line with 2 full pumps. Next is positioning. What most patients do, they tilt their head back, right? Wrong thing to do. So a slight head tilt forward. Whatever side the patient is starting on, just pull at that nasal labial fold a little bit to open up so we have room for the medication to actually go in. They're congested. With the head slightly tilted, insert the nozzle to about that nasal labial fold, and then they're going to aim towards the eye. And that's making sure that we're coating that outer nasal mucosa lining inside of the nose. We are not instructing them to go straight, and we are definitely not instructing them to go midline, which could increase nosebleeds, potentially affect sense of smell, and of course, as we know, simply isn't going to work. So pull at that nasal labial fold to open that congested nostril while tilting forward, put in the nozzle, aim towards the eye. The next step, push down completely to administer the spray. Make sure they don't sniff strongly. It is okay to have a light sniff after if they feel like it might drip out. Literally, I will tell my patients like, we're not going, you know, then we're just sucking it down the back of the throat. It's gonna taste bad, not work, make you nauseated, all the things. We've done one side and you're gonna turn around and do the other. Sometimes patients feel like they have to switch hands. You do not have to switch hands. So just move over to the other side, pull away to open up the nostril, insert the nozzle, aim full pump down. That head is tilted slightly, light sniff if needed. Make sure after the medicine has been administered, 1, do not blow the nose for at least 15 minutes, ideally 30. And then I recommend that patients not lie down after. You don't want it dripping down the back of the throat. So plan accordingly if they're going to administer it at bedtime, because you don't want them doing it literally right before they get into bed. After that, make sure they clean the tip of the nozzle. I usually just tell patients, run it well under warm water, take a clean cloth or tissue, dry it off. You want to make sure this nozzle is cleaned well for hygiene purposes. Simple, quick tip, make sure that they're doing that. All right, now it takes longer to explain the what and the why when we go through that, but I'm going to now demonstrate for you how to have this conversation pretty concisely with a patient. Okay, Sarah, so I'm super sorry that nobody showed you how to use this medication. Today, we're gonna fix that. And technique is super important for the medication to do its job. The first thing that you're gonna do, I want you to gently blow your nose. Grab a tissue, clear out any mucus, because we wanna maximize the absorption of this medication, that it's able to get to the nasal tissue to be absorbed. So gently blow your nose, don't blow forcefully. When you blow forcefully, you actually worsen the swelling in your nose. Then the next thing is you're gonna gently shake your bottle to mix up the medicine. If it's a new bottle, you're going to prime it. In other words, just pump it down twice, releasing air so that when you go to use it, you're getting a full dose of the medication. Now, Sarah, you don't want to tilt back. Remember, that's what you were doing, and that medicine just goes straight down the back of your throat. It doesn't get absorbed into the nose and towards the sinuses where we need it. You're actually going to tilt slightly forward. Then you're going to kind of pull on your cheek here to open up that congested nostril. Insert the nozzle. The top of it's going to come to about right here. Okay? Insert and aim for your eye. Push down all the way once and administer that spray. Do not sniff strongly after. Maybe A light sniff if you feel like it's going to drip, otherwise no sniffing. Then you're going to do the same thing on the other side. Pull open, insert the top of the nozzle to that level of the fold there, aim towards the eye, pump down fully. Light sniff if needed, otherwise no strong sniffing. That head is tilted slightly forward the entire time. Make sure, Sarah, that you do not blow your nose for at least 15 minutes, ideally 30, after you administer it. You don't want to blow that medication right back out. You want to make sure it has time to be fully absorbed. Also, don't lay down for 15 to 30 minutes afterwards. You don't want it dripping down the back of the throat, going the same way as if you had have just tilted your head back. So that's the proper way to use it. Use it this way. It's going to give you the effect that you're going for. The next thing we tell Sarah is this may take 3 to 7 days, sometimes a week and a half, depending on how chronic your symptoms are, to really begin to see effect of the medication. So proper use and consistency are key. This is how you would teach how to use that nasal spray. It really doesn't take a lot of time. It's just having the verbiage down, practicing the narrative so that you can spill it out pretty quickly. And then you want to ask Sarah, now tell me really quickly how you're going to do this, and let her walk back through that to reinforce what she's learned. Let's be real. Not every patient is going to remember everything that you tell them in this compact conversation. Reinforcement matters at follow-up, especially if they have chronic use. Checking in with them, how to use that nasal spray again, and then listening to them tell you or watching them show you the proper way to use it. If there's a couple of things that are messing up, you can clean it up at that time. Just remember to let Sarah know the type of medicine also matters. Corticosteroids are not going to be like Afrin where you notice the effect right away. It's going to take a few days to a week and a half for that medication to take effect. So consistency along with proper technique is super important. They need to know proper expectations so they don't give up prematurely, especially if they've already gone through weeks of not administering it properly. Giving that information up front has saved me tons of follow-up MyChart messages or calls, patients complaining they're not getting any better. Make sure that you have that discussion with them to save yourself. All right, if you have made it this far in the video, I want to give you something that's going to make your life easier. We know treatment failure with nasal sprays can often lead to unnecessary antibiotics that have been justified but really not truly necessary. In my bio or down in the comments, click the link, get the top 10 patient-approved phrases to say no to unnecessary antibiotics. This gives you 10 proven, compassionate, effective phrases to be able to say no to unnecessary antibiotics. Hit the link, download it, share it with some colleagues. I'm working on something that I'm very excited about. A patient education video that will save you time in the clinic. You can simply save the link, use it as a smart phrase, send it to your patient in MyChart, or embed a QR code to the after visit summary they can scan, pull up a video to watch. You can say, hey Sarah, technique is super important. I want you to check your MyChart for a video link I've sent you, or I want you to make sure you get that after visit summary, check out the QR code, pull up the video. It's going to show you exactly how to use this medication. Make sure that you do that, otherwise this medication won't work for you. So imagine just being able to send a link, shoot to your patient in a MyChart message, or have a QR code that can be embedded quickly into their after visit summary to help reinforce this education, or even have the conversation for you. Save you time in the clinic, but not compromise effective treatment. If that sounds good to you, hit subscribe so you don't miss a beat, and let's raise the bar together. Sorry, haven't used nasal spray, you know, allergies, fall, Kentucky. Thankfully, I know the right way. So you're congested, you try to tilt your head back and get that medicine up in there. I'm gonna make a short out of that. In the nostril. So maybe it would be the end of the world. I'll see you in the next one.